Why you need a medical checkup for menopause. What every woman 40 plus must know. Good day, I'm Nurse Maria Nurse Joseph, and I'm a menopause nurse, and I would like to delve in this topic. Let me tell you a story I hear every week. A woman in her late 40s walks into the clinic, tired, foggy, gaining weight, even though her routine remains the same. So she assumes it's stress or age, and she hopes it will pass. But when we run a proper menopause checkup, we find things she never expected, like early bone loss, hormonal imbalance, rising heart disease risks, things that could have been prevented if she only knew sooner. Now, in the next few minutes, I'm going to show you why a menopause checkup isn't optional, it's essential. Whether you're in perimenopause, menopause, or postmenopause, this will change the way you understand your health. I promise though, by the end, you'll know the tests you'll actually need, what's normal versus what's not, how early diagnosis prevents long-term disease, and the first step to getting your personalized care. Why does a menopause checkup matter? Menopause isn't just hot flashes and missed periods. It's a total body shift affecting your heart, brain, bones, metabolism, skin, and mood. When estrogen drops or when it declines, everything changes, not just the temperature. Over 80% of women never get proper menopause care. Many suffer for years without answers. A medical checkup gives you clarity, early detection, proper guidance, and a roadmap instead of guessing. What actually happens in a menopause checkup? Let's look at the consultation. This is where everything begins. We sit and talk deeply about your symptoms, your history, your cycle changes, your mental health, your lifestyle, and your goals. This is how we build your personalized menopause roadmap. Diagnostic blood tests. These tests help us understand what your body is really doing. We check estrogen, progesterone, FSH, LH. We test your thyroid, which often mimics menopause, blood sugar and insulin, cholesterol levels, vitamin D, testosterone. It's not about numbers, it's about patterns. Screenings and exams. For women 40 plus, these screenings are essential. Pelvic exam and pap smear to detect changes and atrophy. Breast exam plus mammogram / ultrasound. Your breast tissue changes during menopause. Bone density scan would pick up your bone mass in the first 5 years post-menopause. Women can lose up to 20% bone mass. Heart and blood pressure screening would look at cardiac risk because menopause increases cardiac risk. These tests help prevent the things that catch women by surprise. Let us now look at risk assessment. Menopause isn't just about today, it's about the next 20 to 30 years of your health. We assess your risk for osteoporosis, which is declining estrogen levels accelerates bone loss. Hence the reason why many women fall and get fractures of the hip, particularly, and other bony areas. Heart disease, your risk becomes equal to a man's. So therefore, women risk for heart disease is equal at around that time to men at that stage in their life when it comes to heart attack. Cognitive and mental health changes, brain fog, anxiety, memory, metabolic changes, weight gain, particularly around the waist, around the belly area, that stubborn fat, insulin resistance, blood pressure shifts. When you know your risk profile, treatment becomes precise, not guesswork. Symptom management options, hormone therapy, hormone replacement therapy. Hormone replacement therapy is one of the most effective treatments we have and one of the most misunderstood. It's not one size fits all. It's certainly not mandatory, but when appropriate, it can be life-changing. Non-hormonal options for those who can't or prefer not to use hormonal replacement therapy. We do have alternatives. We have medications for hot flashes, sleep, migraines, anxiety, and more. Vaginal and sexual health, these issues are medical, not something you just tolerate. We have options like local estrogen creams, vaginal rings, tablets, and treatments for chronic urinary tract infections. Special cases: premature menopause, surgical menopause, cancer-related menopause. These require supervised, specialized care. Now let's look at lifestyle foundations. Menopause care is medical, but it is also holistic in approach. So therefore, we look at nutrition and anti-inflammatory, high protein, blood-friendly nutrition. We look at exercise, especially strength training, sleep and stress. Menopause affects circadian rhythm. We look at the mental health, which is CBT, therapy, and support groups. We look at pelvic health, physio, proper Kegels training, prolapse, uterine prolapse prevention. These changes accelerate your results. Now, the next gen menopause health audit is where we use to put our focus on the management of women at this time. So now you understand why a menopause checkup is not something you delay. Your heart, your bones, your hormones, metabolism, everything is shifting, and you deserve to know exactly what's happening inside your body. To make it easier, we created the next gen menopause health audit, a complete in-depth assessment designed especially for women 40 plus. What you get? You get a full consultation, full diagnostic blood testing, all essential screenings, complete risk assessment. your personalized menopause plan, because one fit is not all fit. So your personalized care would deal with your particular symptoms. And because it's Christmas, we are offering 20% off the entire menopause audit. To book your menopause health audit, click the link below. Spots are limited, especially this season. You deserve answers, you deserve support, and you deserve to feel like yourself again. Thank you for watching. This is the Healthy Reset, where menopause matters. I'm Nurse Maria, and I'll see you soon.